Hey, Todd, it's great to see you.
You too. Thanks.
Thank you so much for being on. So, obviously, I want to know your medical expertise on this topic. But before we get into that, you are an endurance athlete, or you say you were an endurance athlete, but I don't know
Well,
if I buy that story.
yeah, I am. I have been for years. I got into bike racing in high school and triathlons in college and I've finished 8 Ironman races. I've done, you know, quite a few triathlons. I've run a few marathons here and there. And mostly now I run around my work schedule. I'm not doing as many triathlons as I used to, but I still run a bit and still try to run on a regular basis and do something on a regular basis. And, when time permits, I still love going out for long bike rides.
Oh, I love that. And I love as a doctor that you understand the endurance athlete.
Absolutely,
And
yeah. It's a unique
that is
population, and one particularly in sports medicine, it's a unique population because it hasn't always been the focus of the sports field. So, yeah.
awesome. And so, how did you decide that you wanted to be a sports medicine doctor?
So I took a little bit of a circuitous route to get here. I'm emergency medicine trained. I did my residency in emergency medicine. And I practiced in the ER in some Northeast or urban populations for 10 years, predominantly in the Philadelphia area. And then I went back and did a non-surgical sports medicine fellowship. And currently now I work at the hospital for special surgery up in New York. My practice is a
So,
lot of endurance patients and a lot of acute injuries and all that.
I'm assuming that because of your personal interest in endurance athletes and athletics in general, that's played a role in you deciding that this was going to be your path.
It has, yeah. Even when I was a resident years ago in emergency medicine, I sort of kicked around the idea of doing a sports fellowship and I just didn't do it right away. I took my time doing it. But yeah, there was always kind of an interest. I was always jumping in and trying to do, cover some sporting events and, whether it was helping out with a cycling race or something like that from the medicine side, or if I wasn't running in a local running race, trying to do some of the medicine side of that. So yeah, it was always on the sort of on the at least ideas of what I wanted to do in life and how I wanted to gear my practice. And it's been a nice way to do it.
So, do you have people that are constantly asking you for advice, like your neighbors and your running
Sometimes,
buddies? And
sometimes, I'm always happy to help out. It's fun, what I do, but it's also what I'm interested in. So I enjoy it. Yeah.
that's
I'm
awesome.
always happy to talk about, the pros and cons of running shoes for injury prevention and things like that. So
You're a good person to know. Yeah, I'm sure. Yes. So, I have noticed, and I'm wondering if you have seen this too, that it seems to be a trend now for people wanting to do back to back marathons
Mhm.
or marathons in close proximity to each other. And I guess how I define that is like shorter than a typical 16 to 20 week marathon
Right.
cycle. So I'm not saying like, you run one and then you turn around the next day and run another one or even the next week, but like within several weeks or even just a couple months of one another. Have you been seeing this?
I have quite a bit in my practice. Yeah. And I don't know exactly why, and I'm not sure when it started, but yeah, definitely, at least in the last few years, I certainly have seen an uptick in that. And, speculation, maybe it has something to do with all the races being clumped in the fall the past few years. And there's certainly, as we got back to these mass start events, we certainly ended up with them all in one particular fall a year ago. And I don't know if that really inspired people to cram in as many marathons as they could or what. I definitely see a fair amount of that. I see people in the office who come in, if they didn't have the performance they wanted, deciding that, well, I'll just go run another one in 3 weeks or 4 weeks or a month and things like that. And I don't remember seeing that quite as much as we do now.
Yeah, that's definitely something that I've seen that if you don't hit your A goal when you're running a race, then you're like, okay, well, I'll just try again.
Yeah.
Okay, so let's start there. If that is what happens, let's start with the good stuff. Are there pros to doing that as far as maybe perhaps your fitness boost or, the strength, like your muscular skeletal strength from, enduring that
Right.
long event and then turning around 3 weeks later, like that would be your peak run. Are there benefits to doing that?
There's not a lot, unfortunately. The flip side of this discussion could be a little bit more involved, but overall, it can work for people, right? Particularly if somebody is having a bad day, and the one we saw in my neck of the woods, the one incident where this comes up at least the last two falls has been running New York City and then switching and running the Philadelphia Marathon 2 weeks later, because they're always 2 weeks apart. If you decide early on in the New York City Marathon that it's just not things aren't going quite like I wanted them to, I'm just going to dial it back. I'm going to take it easy. This is just going to be a long run. And I'm going to make sure that I'm not too beat up after the race. Then it's not unreasonable to think about 2 or 3 weeks later, considering that your race and just shifting that a race. And the training has been done. It's still a little bit difficult though. You can walk 26 miles and beat yourself up pretty good. So even taking a marathon slow is still a really big effort for people to do. Even if you're really fit, it still takes a lot out of you. It's still taxing to the body. So the ones in that case that space it out a little bit more may be a little bit better off, because you don't push it too hard. You can recover pretty quick and you can still do the race off of those performance benefits from the buildup and the training for the first race. But yeah, overall, it's tough to give a lot of positives for that scenario, unfortunately. Giving away the rest of this talk already, aren't I? But yeah, it's just the physiological load of running a marathon can be really tough, and it can be tough to recover. So you have to be really careful doing it. Finding all those positive things to come, and the reasons to do it are a little bit less than the reasons not to, potentially. But it doesn't mean it's an unreasonable thing to do. It just means that you have to really think it through beforehand.
Let's talk about the physiological demands and damage that is done. I mean, I know
Yeah.
everything from your liver, your heart, your
Yeah.
muscles, they're all damaged.
Right.
Can you talk about what happens to our bodies when we run a marathon?
Yeah. So there's a few different physiologic systems that are affected pretty significantly, right? Just so first off, your energy stores are, for lack of a better way of putting it, completely depleted, right? I mean, you use up everything you have and then some, which is why you need to replenish on during the race. You get a significant amount of muscle breakdown. You see things like your total CK, which is one of the enzymes that goes up in your bloodstream with muscle breakdown. That can go up incredibly high after a marathon, and it could stay high for, days to a week or more after the marathon. Even after the muscle soreness is gone, you can still have elevation of that. Your kidneys are involved in clearing that. So your kidneys are working harder for that. You're dehydrated. You're trying to retain water and recuperate fluid loss. You're right. Your liver and your heart are both affected significantly as well. Cortisol levels go up significantly post marathon. You're at an increased risk of getting a cold or flu or viral illnesses, which, we know there's plenty of data to show that most, we're dealing with a very healthy population in theory that runs marathons, right? And that healthy population has a significant increase in picking up, whether it's the common cold or other viral illnesses in those first several weeks after a marathon. And it's because your immune system is down. So you're right. Every system gets affected.
And do you know the time scale of how long it takes for all these systems to be fully recovered?
So we don't know an exact time scale. Generally, a lot of people use that gauge of when do I feel good? When am I no longer sore? Well, we know it extends beyond that. We know that, the inflammatory markers that we can test for are up well beyond when the soreness of muscles goes away. If you're sore for 3 or 4 days, those markers may be high for a week to 10 days. So it's beyond when you necessarily start feeling better. And yeah, there has been some speculation that it can be a month or more before you fully are recovered with adequate rest, the load of a marathon. It's a long way to run.
It
Yeah.
is. And so with that in mind, so let's say for at least 4 weeks,
Mhm.
what if somebody races a marathon, but it doesn't go how they want, and then should they wait at least 4 weeks, or even still to take, 4 weeks of low to light mileage and then jump back into a marathon, 6 to 8 weeks after your previous marathon? Is that still too risky? Not too risky, but risky, I should say.
So you have to go into that with the mindset. The second one may not go great either. You just don't know. There is always that. If you're lucky and you recover well and, you take care of yourself and you really focus a lot on recovery, there's always the chance that it's going to go really well. And, you've recovered quick enough and you get those performance benefits. That means getting a lot of sleep, normal or much more than we normally get. I know a lot of my runs are early in the morning or in the evening, when you probably should be sleeping from recovery. Drinking plenty of fluids, eating well. After the first race, you need to, particularly if you know you're going to do that, you really need to focus on getting your nutrients back in, pretty much from when you cross the finish line to start rehydrating and start focusing on that recovery like you should anyway. And it can go very well. I know I sort of downplay, I don't want to necessarily downplay the potential for the whole thing to work out, but it is a little bit risky that it's just not going to go well. You don't run the risk of really hurting yourself per se. You run the risk of not feeling well, negative performance because of it. You can get into the risk of potential injury and stuff if you just jumped right back into training, but there are ways to do it if you're going to do it. And that's usually involves not doing quite the training load for that second marathon. That gap needs to be more of a focus on recovery. Your long runs between the two marathons may not exceed 12 miles or so, 13 miles, not running more than a half marathon in training for that. You may skip pretty much any intensity work and really just focus on trying to recover and get your legs back. So, and there are tricks you can do to try and speed that up.
Would love to hear those.
So cross training is great, right? You've already got fitness from running. Your legs aren't running well right now because they're a little bit beat up. So getting in the pool and swimming, I mean, sound like a triathlon bias here, right? Getting on a bike and riding a bike. I am a big proponent of, and I advocate a lot of my patients for numerous different issues to consider deep water pool running. You know, admittedly, most of my patients or runners that I've advocated doing that are for injury rehab or to maintain running through an injury or for recovery. But it can even be something it's known to have pretty good performance benefits just from adding it into your regular training anyway. But getting in the deep end of a pool with a flotation belt and, running laps in the pool is low impact. It's essentially zero impact. And you also get the compression from the water, which is great for helping, sort of venous return from the legs and things like that. If I was trying to stack two marathons fairly close, then my first few runs would almost definitely be in the pool like that.
Yes, I've tried aqua jogging. I've
Yeah.
dealt with several injuries
Yeah.
and mentally it's hard.
It is hard. Yeah. You go slow. Everybody swims past you. You feel a
Yes,
little bit
yes.
silly bobbing up and down in the water. Yeah. So it is mentally very difficult. So, uh,
Yes, you probably just needed to embrace it more.
yeah. So,
Okay, so say I'm assuming that a lot of runners that are listening to this are probably thinking, well, if I just run a marathon, if I'm in it, I start it and I'm like, this is not my day. I'm just going to run it for fun. How is that extra few miles in a marathon than we do in our like peak long
mhm,
run that much more demanding? Like a lot of people do 20 plus milers
right.
several times in their training cycle. So how is that much different?
So it's a tough one. Likely you've started out with the goal of it being a good race. So the decision's made that it's not going well partway through. And if it's not going well partway through, it's probably for some reason, whether, are you just not feeling great? Have you picked up a little viral illness? Did you not plan your nutrition right? So the reason that you're cutting it back isn't just to schedule another marathon. It's because something's not going right in this one. So you've essentially emptied the tank a little bit early for one reason or another, which is very possibly out of your control. But it means that you're not recovering from the well-prepared long training run that you did and, sort of that long, slow distance training run where you're just accumulating long miles. You went out in the marathon and you went for, what your goal pace was. And you partway through, whether that's, 3, 4, 5 miles in or at the half point or potentially further on, you decided it wasn't working out because something was going wrong. So whatever was causing that and led to that decision means that you're a little bit behind where you were after a normal long training run anyway.
What about the scenario of someone they just love to run races.
Mhm.
And so they're not racing. They're not, running and pushing themselves. It's just a too long, slow distance.
Yeah.
Are there risks to that? I mean, if you do one and then if you do New York and then 2 weeks later turn around and do Philly, I mean, are there risks for that or?
So that's the setup for the person who's probably the most successful at doing this in the sense, not necessarily in the sense of like they run their fastest time or anything, but of getting through these, multiple close marathons. If the decision is made a year in advance when you signed up for both, that this is my goal, and you focus your planning and your training and you focus your recovery between the two marathons and you plan your pace accordingly that, you know, I'm just doing long runs. These are bucket list marathons. And my goal is to be on the starting line and be at the finish line, which is great. I think that's fantastic. You still do run the risk of, it's a big load and you're probably not doing much of a training load at any point in your training. So you can get into the overtraining. You know that there are negative performance effects of stacking marathons close together, particularly repetitively like that. But if your goal was that goal, I think if you go in with the mindset of that, that's probably the best outcome as far as being able to do this without doing too much damage.
So I guess, if you do that every once in a while, like you said, post COVID,
Mhm.
there all the majors were
Yes,
stacked
that's
close
right.
together.
Yeah.
Then it's, you might be able to get away
Right,
with this.
right.
But if this is a habit, if you're
Yeah,
running 6 marathons plus a year,
yeah.
is there a good chance that you could be facing injury,
You
overtraining,
certainly could get,
etc.?
yeah, depending on your training we talk about in all sports now, we talk about acute and chronic training loads. We know that sort of that huge spike in the acute training load is probably one of the most significant injury predictors in distance running. And it usually falls about 6 weeks after that spike in the training load that the injury shows up. So you may do run the risk of, when you're spacing them 4 to 6 weeks out or whatever, of, whatever happened from that first marathon, you're going to start seeing the negative effects or the overuse injuries showing up while you're running the second one, which is not going to be a good outcome. We know that performance certainly declines with a marathon. Running 6 marathons a year, you're probably not going to hit your peak performance on any of them. But if you're okay with that, you know, then that's okay. Again, finishing a marathon is not all about the time, which is great. But I love the fact that more and more people are running marathons and running well over the time wise, running a huge time range, and I think it's fantastic. So if that's the case, I sort of got off track of your answer there or your question there a little bit. I
No, but I,
apologize.
lo- I like doctors
So,
say that because,
but
so many of us, like, we walk into a doctor's office
yeah.
and they're like, well, you should probably stop running or you can't run with that injury.
No,
And
and
it's
I
very
tell a lot of my
frustrating.
patients, I'm not the best person about telling people to stop running. I can find all the articles that'll say that you should keep running with this injury or that, with the exception of a few, because the health benefits of running, whether you're racing marathons or just running to run, the health benefits far outweigh the negative effects of not being active and healthy.
100% agreed, of course. That 6 week mark, that's pretty interesting. Are you able to share more of why you think that is, as far as like, the stress on the tissue and then the remodeling that may or may not occur?
So so that's sort of the answer right there, but it is very much speculation. Whether it's muscle or tendon cells, we know that they respond to a stimulus, right? And we know that there's a time frame that it takes to respond to a stimulus. One of the outside of the running perspective, but more in just the general fitness realm, if you go to the gym and you start a weight training program, most people start noticing that they can put more weight on the bar or lift heavier weights around a month or so in, let's just 6 weeks. And that's because that's how long it takes those cells to adapt and start to respond to the stimulus. Oftentimes, that's why,
Mhm.
when I send somebody to therapy, I usually see them back around the 6 week mark to see if there's a change. Because there's not usually a
Yeah.
change a week or two in. You haven't had time for it to respond. The effect of the acute training load versus your chronic training load is very similar. It's a negative effect, right? Because it's an injury as opposed to a performance gain. But it can actually be,
Mhm.
it can also be seen in the performance benefits of it. But that 4 to 6 week window is oftentimes looked at in both the sports medicine world and the training world. And that's what we're seeing is that same effect. And it really comes down to the ability of muscle and tendon cells to respond to a stimulus.
Interesting. Well, and that, of course, plays into where you want to put your long run. You don't want to put your peak long
Right.
run too
Right.
close to your
Exactly.
marathon.
Yeah.
So, if somebody has decided that this is what they want to do, they are going to race a marathon and then they're going to turn around a few weeks later and run a marathon just for fun, or they didn't hit their A goal and they're going to turn around and go for it again, 1 to 2 months later, what should they be looking for to make sure that they're doing this healthily and they're not going to be facing potentially injury or excessive fatigue or overtraining?
The recovery phase, look at it as the training was done. You've logged the miles, you've put the training in for that first marathon. The gap in between the two really should be about recovering from the first marathon, getting plenty of sleep, rehydrating and replenishing all the nutrients lost in that marathon early on, trying to eat a well balanced diet, not trying to crash, lose weight or anything like that in between if anything,
Bad idea.
try to fill back up on, fill the tank back up basically. And then as far as the training goes, it's really about, again, we had talked a little bit earlier, some cross training and low impact stuff to get those muscles moving, mobilize the muscles a little bit, and then start some light training. You don't need that really long run. You probably, if it's 4 to 6 weeks between marathons, You probably don't need anything more than maybe 12 to 13 miles or so at most. You probably don't need a huge amount of intensity work, maybe just a little bit of, to get the legs picked up and as they're starting to feel better and it's getting closer. But it's really about, focus on recovery and getting ready for that next one, not necessarily trying to add a lot of performance gains to it or strength gains to it, because that's where you can actually start to have a negative effect and start to end up with a negative performance from it.
And if you still feel lethargic on your runs or just overall more tired than
Mhm.
usual, would you recommend not to do the second marathon?
Yeah, I think you have to sort of, it's always hard to tell people not to run it. If things, if you're
Mhm.
really feeling kind of down about the running, if you've got some nagging, do I have a little overuse injury here or there? It's certainly not a bad decision to skip out on it. It is always a little bit of a personal decision. If there's no red flags that say you can't do it. Yeah. And there's very few red flags in running where we tell you flat out, you can't run. If you take, aside from stress fractures, I very rarely tell people. So in general, I don't necessarily tell them they absolutely can't do it, but you definitely have to change your goals and your expectations if you're still feeling under the weather or a little bit banged up, for lack of a better way of putting it, from the first marathon.
Yeah, I feel like the period in between is essentially a reverse taper in a way.
Yeah, exactly. That's a really good way to put it. So yeah,
And if it is something that you decide to do, you think of the first marathon as your long run, and then and so the hay is in the barn, and
yeah,
then, yes, you just really
yep,
focus on recovering, getting your glycogen stores back, just
yep,
filling everything
yeah,
back up because
yeah,
you were completely depleted.
yeah, exactly.
Is there anything that I didn't ask you that I should have?
I don't think so. I think we kind of covered the subject pretty well. So
Well,
did I
I
leave
learned
anything
a
out?
lot.
So
No, I don't
good,
think so.
good. Yeah.
I feel like you're very rare in that you love to keep runners running. I just think that's like so awesome because
There's more
it
of us
is
out
such
there
a
now
healthy
than there used to
habit.
be. Yeah.
Yes, that's
Which
for
is good.
sure.
So
That's for
yeah,
sure.
there's definitely
Yeah.
a change in the sports medicine world in paper, I think, which is great.
Yes, me too. Yes. So much. I mean, I was just talking to somebody before this. He was like, "Yeah, I used to run all the time, but I have bad knees and the doctor told me to stop and I was really sorry. I just really miss
Yeah.
it." And I was like, "No, but you can.
Yep. You can.
You
There's
can.
plenty of evidence to support that. And so,
Let's talk about this." Yeah.
yeah,
Well, thank you so much for
my
your
pleasure.
time and
Yeah.
sharing your knowledge
Yeah.
with us.
My pleasure.
Bye.
Thank you.